Maria von Kerkhove, our technical lead for COVID-19. We have also Dr. Bente Nicholson, Director of Non-Communicable Diseases.
Developed and it's been outlined very clearly that it's a safe and effective vaccine that is so much of the world is working towards, and that's really wonderful. But there's so much that you can do now. And I think we will hammer this as much as we possibly can, because there are individual steps that you as an individual can take to protect yourself from getting infected, to minimize your exposure, to manage your risk. This has to do with how you live your daily life, and everybody wants to get back to, a normal life and get back to what used to be, but we need to make considered decisions about how we go about doing that, how we go to work, if we need to wear a mask where we can't physical distance, we need to practice hand hygiene and respiratory etiquette, avoid the 3 C's, these crowded spaces and closed settings, especially with poor ventilation. There are ways in which you can minimize your exposure, and to be informed. So what is really important is that you know where the virus is in the areas where you live and in the areas where you work. And this comes from the strong government-led responses that we are seeing in so many countries. The strong, clear response at a national level implemented at the local level. What we are seeing now is countries that, in the beginning, many had to put in these national lockdowns, so-called lockdowns, because they needed to buy themselves some time to take the heat out of the virus, out of the transmission, and get some time to get their systems on track. Many countries have a public health workforce now. They have testing capacity that has been greatly increased. They have contact tracers that are out there, that they're preventing clusters from happening, or when clusters do happen, they're rapidly carrying out these outbreak investigations. All of these things are really positive, and I just want to highlight this because we are seeing many countries apply these public health measures and taking at great effort and bringing outbreaks under control. And these are things that are happening now. So we need strong government-led responses. We need very targeted, tailored, local implementation so that we could avoid national lockdowns again. And we are very hopeful, and we are seeing in many countries they're applying targeted, time-bound, geographically bound measures to bring outbreaks under control, and using all of the active case finding, contact tracing, training your workforce, protecting your workforce, improving clinical care, getting hospitals ready. All of that is still happening in the background. And countries that have been successful in suppressing transmission are ready. They are ready to identify cases very quickly. They're ready to identify clusters and carry out the necessary steps to prevent those clusters from becoming community transmission. So I just want to emphasize that there's so much that all of you are doing now that is benefiting society and is helping this pandemic. So please, be hopeful and be empowered that there's a lot that you can do.
I think Dr. Bruce has something to add. Bruce?
Yeah, I think just to help Mr. Kumar, that was an important question. I think it's hard for the general public when they're hearing these sometimes substantially different assessments of how long it will take us to actually have a successful vaccine, and if indeed these trials are successful. And sometimes it's helpful to demystify these timelines a little bit. But if you think about these trials, what you keep hearing, phase 3 trials, remember these involve tens of thousands of people, usually the large ones we really need to see an effect of the vaccine on. You have to give people 1 dose, and then usually it's at least 2 weeks or 3 or 4 weeks before they get the second dose. And by the time you enroll that many people, get those 2 doses in, that's often 3 months or longer. And it can't be shorter than 2, obviously, but it's usually a few months just to get that many enrolled in the trials. And then you've got to observe them for a long enough period to understand who is protected and not protected. So, and there you're a little bit at the mercy of the epidemic itself, because it depends on how much disease is actually circulating in the community by that point. And then when you finally have that, which will take a couple of months, a few months, depending on the intensity of transmission, then you've got to analyze those data. You've got to get the product licensed. Now, there's some things we can do to speed things up. We can, if we think it's a very promising vaccine, we can produce it in parallel at risk. Even if it fails, we'd have to throw those doses away, as you've heard. But there are other things you simply can't speed up. And this goes back to the important question asked earlier, if I remember it was by Anna, I believe, about, the vaccine confidence. We can accelerate many parts of the process, and we'll work very, very hard to do that. Scientists, manufacturers, everyone is doing their best. But you cannot accelerate certain parts which are essential to ensuring the vaccines are safe and efficacious. That takes a certain amount of observational time that you simply can't rush. And it would be in no one's interest to rush that part of it, because that is what would shatter the confidence and trust, which is so important in this process to roll out these vaccines. So when you stop and think a little bit, these phase 3 trials, how big are they? They're going to give 2 doses up to a month apart, and then they're going to have to follow those people for some time. You can understand why these timelines can be fairly long between now and when we have a definitive answer. And also, some of the factors are simply out of our control because it will depend on how intense transmission is in an area.